So you may have seen a study on the news about how colonoscopies may not prevent colon cancer. Oh my goodness, this is crazy. Well, Dr. Islam here, I'm here to give you the bottom line, literally, of what the study means, my interpretation, and what you need to take home to make sure you save your life from colon cancer. So for those of you who don't know, a new study came out in the New England Journal of Medicine which proposed that doing a colonoscopy may not be as effective in reducing colon cancer as what we thought. Now in this study, they randomized patients in Norway to get a colonoscopy and to not get a colonoscopy and follow them for about 10 years to see what their risk of developing colon cancer was. What they found was that those individuals that got a colonoscopy only had an 18% reduction of developing colon cancer and no change in colon cancer death versus those that did not get a colonoscopy. So when you read the study, you're like, okay, that doesn't seem like a lot. What's the point of doing a colonoscopy? Here's what you need to know. In this study, only about half of the people actually got a colonoscopy, only 42%. It is hard to make any conclusions with any study if less than half the people actually followed in the study. And when you look at the actual individuals who got a colonoscopy and compared their deaths and their risk of developing colon cancer, that procedure was found to be more effective in cutting that risk for developing colon cancer, almost 30%, and also cut the risk of dying from that cancer by half, 50%. So here are my thoughts. So number one, doing colonoscopy in Norway is very different from doing colonoscopy in the United States. In Norway, you don't get sedation. I mean, I can imagine being in Norway and a doctor coming in, hey, you know, I think you need a colonoscopy. Oh, great, sign me up. Well, what does that entail? Well, we stick a probe up your bottom while you're awake, and we try to find these polyps and remove them. I'd be like, no way, I would not want to do this. And in the US, we don't do that. Almost every single person gets sedation. And this is why the number of people who actually got the colonoscopy in Norway was so low, only 42%. Now, for those that did colonoscopy, absolutely, in this study, it showed it was effective in decreasing your risk for developing colon cancer and decreasing your risk of dying from colon cancer as well. Number two, quality matters. In here in the United States, we have quality measures that let us know if we're doing a good job. I know if I suck as a GI doctor, and I know if other GI doctors suck. There are quality measures that we have. In Norway, those quality measures were not very good. Those individuals that did the colonoscopy weren't the best trained. They didn't have the best records. They didn't really know what they were doing. And I will bet you, if you have a high quality person who knows how to find precancerous polyps, the data shows over and over and over again that those individuals will decrease your risk for developing colon cancer. And number three, the benefits of colonoscopy takes time. Detection and removal of polyps removes a future cancer. If we assume that the usual care patients had the same rate of developing precancerous polyps and they were not removed, it will take time for us to see if they develop colon cancer. And the good thing about this study is that they're going to look at further data down the road to see if there's an actual change going on there. So here's the bottom line. Number one, don't let media headlines throw you for a loop for what you need to do. Number two, every single GI doctor here in the US agrees 100% the best way to prevent colon cancer is to get a colonoscopy. We can find that polyp, remove it at that time, and literally change your life from developing colon cancer to not developing colon cancer. And number three, most of the patients in Norway skip their colonoscopy. Well, if you skip your colonoscopy, you're gonna get cancer. And a test can't prevent cancer if it's not getting done. So get your colonoscopy, do it at the latest at the age of 45. If you have a family history or other medical conditions, make sure you speak to your healthcare provider about whether you need to get your colonoscopy sooner.